Game-changing surgery to regrow part of a leg bone using human tissue created in a lab has been undertaken at a hospital in Israel. The experimental tissue engineering technology is being developed by Bonus BioGroup of Haifa, the third largest city in Israel after Jerusalem and Tel Aviv. Fat cells extracted from the patient were used to create constituent parts which were then grown on a biodegradable scaffold over the course of 2 weeks. Semi-solid live bone tissues that resulted from this process were then placed back into the patient's body. Normally, the human body is not capable of naturally restoring bone segments, but these biological implants bridge the gap between missing segments and enhance body's ability to heal itself. Because the cells used to grow the bones are from the patient, this helps to minimize the risk of rejection. The procedure was led by Dr Nimrod Rozen, head of orthopedics at Emek Medical Center in Afula, according to reports in the Times of Israel. About the surgery, he said, "This surgery is truly science fiction. It changes the entire game in orthopedics." The procedure was part of an ongoing clinical trial, expected to include up to 40 men and women. In August 2016, as part of the same clinical trial, a similar procedure saw a 40-year-old patient who received an implant to repair forearm bone lost in a car accident. The surgery was also led by Dr. Rozen, who is one of 3 doctors on Bonus BioGroup's scientific advisory board. Patients verified as being suitable for participating in the clinical trial undergo a biopsy of fat tissue. This provides various cells necessary for manufacturing a live human bone graft.The manufacturing procedure takes place at Bonus BioGroup's manufacturing facility in Haifa, under controlled sterile conditions. In a separate clinical trial started in 2014, the firm successfully implanted bone grafts in the jawbones of 11 patients using cells grown from their own fat tissue. The injectable bone graft technique heralded a major improvement over traditional bone grafts, a complicated surgical procedure that is not always successful and requires a long recovery process.